Good Monday afternoon. I'd like to begin with news on a program that has long helped support small communities across Kansas, the Community Development Block Grant, or CDBG. Due to the COVID-19 pandemic and its toll on our cities and counties, the benefit of this particular program cannot be overstated. CDBG funds are effective building blocks for projects that make small communities even better places to live and to work. The Department of Commerce has been working very closely with members of the Kansas business community to make sure they have access to a variety of effective resources needed to weather this crisis. And the CDBG program is now another tool in the toolkit. Through the Federal CARES Act, we are now able to make more than $9 million in additional CDBG resources available in Kansas through the new Community Development Block Grant Coronavirus Response Supplemental Program. The federal funds will be dispersed in two categories: economic development and meal programs. These are grants, not loans, provided to cities and counties to help local businesses and organizations in their communities, and in this instance, for projects exclusively related to the coronavirus crisis. Funds in both categories will target significant areas of need. We know COVID-19 has taken a toll on businesses across the state. Small businesses have inherent challenges when it comes to being competitive. They simply have fewer resources and are now struggling even more due to the fallout of COVID-19. These grant funds will cover critical investments, help small businesses keep their doors open, and keep Kansans employed. These businesses may use the grant funds for working capital, such as wages, utilities, rent, and inventory purchases. For example, the dollars can be used to keep out-of-work hairstylists at closed salons and others who lost their jobs on the payroll. Or they can give a small catering businesses funds to purchase food for their reopening. For a business to qualify, 51% or more employees must meet low to moderate income standards as determined by federal guidelines of the U.S. Department of Housing and Urban Development. For meal program grants, a city that applies must have a population that meets or exceeds 51% of the low to moderate income guidelines. These dollars will help fortify programs that reach Kansans in need. For example, local food banks helping the unemployed, and Meals on Wheels for homebound seniors, and providing meals for children who don't have access to school nutrition programs. Cities and counties can apply for up to $300,000 for economic development grants and $100,000 for meal programs. The CDBG CV program will allow decision-making to happen at the local level and by the people who know their community's needs best. Applications for these grants will be open tomorrow at 1 p.m., Tuesday, May 12th, and will be accepted on a first-come, first-served basis until all funds have been dispersed. More information is available at Kansas Commerce, that's Kansas spelled out, kansascommerce.gov/CDBG-CV. The CDBG funding is just one piece of our state's far-reaching recovery strategies. Our recovery office is ramping up its efforts in the face of staggering economic setbacks caused by COVID-19. As the recovery unfolds, it's important to remember we must all continue to safe practice. Many businesses have reopened with strict social distancing practices in place. I want to thank them for making the changes to keep their workers and customers safe and healthy. And I want to thank every Kansan who is respecting these necessary measures. Seeing places marked on the floor where we should stand at stores and new seating restrictions at restaurants are unusual for sure, but absolutely critical if we're to rein in the spread of this virus. So keep practicing social distancing at all times, wear a mask in public, and wash your hands often. And please, if you don't feel well, stay home. If we all continue to exercise caution, we'll be in a position to continue the gradual reopening of our economy and our state. I know it's difficult, but we cannot let our guard down. We're still a long way from beating COVID-19, so it's absolutely critical that we continue to be as diligent as possible. Our website has the most current information on everything COVID-19 related in Kansas. It's covid.ks.gov. And now I'll hand it over to Dr. Lee Norman, Secretary of the Department of Health and Environment.
Thank you, Governor. Good afternoon. May 11th. As of this date, we have 7,116 positive cases in the state of Kansas, which is an increase in 132 cases since yesterday. 46,993 negatives, 158 deaths, an increase of 1 from yesterday. And the day before, we had no deaths recorded. The state is currently monitoring 78 clusters. The breakdown is much like you've heard me talk about before, 29 in private companies with 427 cases and 5 deaths. Those are companies at vastly different sizes and complexities, business sectors. 24 in long-term care facilities with 575 cases, including 92 deaths. 9 church and other gatherings at 114 cases and 9 deaths. 7 in meatpacking plants with 1,280 cases and 2 deaths. 3 in group living situations with 41 cases and 0 deaths. 3 in correctional facilities, most of those in Lansing, and also the Wichita Work Release and Grossman Center with 863 cases and 3 deaths. And 3 in healthcare facilities with 22 cases and no deaths. Wanted to give you a reminder that beginning today, the data updates on our website will occur on Monday, Wednesday, and Friday. We had been previously doing that 7 days a week. As we moved into the reopening plan, we need to make sure that we have our critical epidemiology staff, many of whom are out in the field in all different parts of the state, use their time in the most efficient manner. The staff spend hours a day preparing for those updates and data submissions. And a couple sidebar points about this. The data is accurate on the website. And data accuracy is critical and important because the submissions we get from the 105 counties don't always necessarily have all the data points. It requires a lot of follow-up. And it's not just a clerical function, it's a science function to do that kind of data recording well. Data guides us. It tells us where to go, where to do case tracking, and what we call case-based interventions. We want epidemiologists as the boots on the ground to reduce the disease burden. So we're trying to hit a happy medium there with current enough information that the public and you all know what's in there and why we update it Monday, Wednesday, Friday. It's very meticulously monitored to make sure it's accurate. But we're not updating it 7 days a week, going to Monday, Wednesday, Friday. I personally don't think there's going to be much lost by that change. Testing. It's an interesting drift that has occurred. You'll recall that when we first started doing COVID-19 testing, that it was mostly done by the state lab with a little bit by the private companies. That reversed so that the state lab was doing about 20% and private companies about 80%. Now we're about 45% from the Cahill lab and 55% from private and other kinds of laboratories. Why do I bring this up? And what it shows is that the increase availability of various kinds of tests that are coming to us in the state, and I see that as a very good thing. And a reminder that with now adequate testing across the state, if you are a symptomatic person, we encourage you to reach out to your healthcare provider for testing. We have abundant, I would even characterize it now, testing capability throughout the state. As you know, every time I'm tempted to give you a science lesson, although briefly, and I couldn't withstand the temptation today either, as much as it might be desired that I do so. But asymptomatic positive tests, what does that really mean? And the reason I want to talk about this is because there's some important points to learn. One is we're discovering that a person can have a positive PCR, the nasal swab test, weeks after having recovered from the illness. And one of the things we're learning is that what that represents more than likely is old disease with COVID-19 in time remote, but it's no longer infectious, is what we believe. I was talking to a doctor over the weekend with a patient in Abilene who was way back in early March on a cruise, for example, and was came home ill with COVID-19. She's still testing positive. There's somebody that's on a television program in Kansas City media. I know of somebody from here in Topeka. Same thing, they're home until they return to negative. I think what we're going to find is that is not a good strategy, because people have what I would call fragments, RNA fragments, or fragments of the virus that doesn't necessarily impart them as to be infectious, but it still tests positive. We are learning things about this virus as time goes on, and I think that this is going to be one of the learned lessons. And again, second, a positive test in a person who's gotten over it is much more likely to be just remnants of genetic material and not necessarily active virus. The one, and I'll tease you with this, is that we will eventually pair it with serology, the blood testing for antibodies. And what it'll tell us then, if it comes back with IgG, which is one of the gamma globulins, one of the antibodies that you produce against the virus, if it come back with a positive nasal swab and a positive for IgG, then you have the illness and you have mounted a good immune response. I'm pointing to my vein here, which is where the blood would be drawn from. So we're learning a lot more about this as time goes on. It's actually pretty exciting, and will help to guide how we manage the boots on the ground in these various communities. Contact tracing. We have 217 people who've been through the training modules as of this past Friday, with 25 existing staff members to continue to assist with the local health departments. You're hearing a theme, and that is we are deploying our epidemiologists statewide. We are wanting to be as helpful as we can, particularly for small health departments that have outbreaks in their communities, and we're pushing the best talent we can to the local health department to assist them in their activity. They still run the show in their county, and we're there to assist. So the contact tracing is a work in progress. We'll keep you posted. Something else that's on the horizon, you may have heard about it. I think I was busy working this weekend, but I think the news broke somewhere that the remdesivir, which is the antiviral, will likely become available in Kansas this week. Remdesivir is an experimental drug manufactured by Gilead Pharmaceuticals, Gilead Sciences, and recently released via an emergency use authorization, EUA, from the FDA. The EUAs allow for clinicians to use non-FDA approved, except approved on an EUA, medical products in a time of emergency, essentially sidestepping the long traditional FDA review process. Remdesivir is used for patients that are quite ill with COVID-19. Typically, it would be somebody on a ventilator and in need of intensive oxygen supplementation. Studies have shown that the remdesivir accelerates the recovery time for COVID-19 patients. Kansas is scheduled to get 10 cases of the remdesivir. I always say that holding my breath a little bit, because I like to make sure that I'll tell you what the numbers are when it finally arrives. It hasn't always worked out exactly as has been promised. But if we get 10 cases, one case treats on average 5.13 patients. And I won't go into the dosing schedules. But that would mean that the 10 cases would serve hopefully between 50 and 55 patients. Typically, it depends on if it's adult or pediatric dosing, that kind of thing. Our staff is currently working to put together a strategy to assist our hospitals and clinicians and how the limited supply will be distributed. In reality, we'll have very little leeway in terms of the recommendations we make, because it's one thing about the 38-page EUA, it's very prescriptive in terms of who can get it and what the dosage are, and then what kind of information follow-up there is for the remdesivir. Finally, phase 1, we're into it a number of days now. Recall that it takes a number of days for the information actually come into us as a state agency. So we think of us being on about day 5 or 6 of phase 1, and it's going to take a while to gain all the information that we can gain. Governor and I and her staff and the rest of my agency staff will be putting our heads together on how we're doing on the metrics, because that's going to really drive a significant amount of the thinking, I'm sure, in terms of the where we will be in the various staging of the recovery. We'll be a lot smarter by even mid to late week. Why mid to late week? Because the The cases that become positive are usually on day 4 to 7 following exposure. So if you think about it now, phase 1 is highly reflective of what was happening in the 14 days before entering phase 1. So it'll take a few days and a number of days into now phase 1 to understand the effect of phase 1. So 4 to 7 days of lag time is the average before becoming symptomatic oneself. That's why I say that from mid to late week we'll be a lot more knowledgeable. And it is not going to be easy to interpret. It'll be a confusing discussion. Why? The reason is because we are doing so much more testing, and all along we've said there's going to be a lot of illness out there that's been undiagnosed, and we've had because of the lack of testing ability. So there's going to be an uptick in the total amount of cases, which of course we see as a good thing, because that, again, we turn it over to the boots on the ground for the case-based interventions, management by local health departments, and epidemiology doing their contact tracing. So what I see this as is we're moving through the work that needs to be done. So it's a bit of art and science to interpreting the data. Hospitalizations and death rates are pretty easy because those are endpoints that are binary, yes or no. And we're improving, we're stable to improving on hospitalization and death rates per capita. The tricky one that will require both science and art will be on the discussion of new cases at this time when we're having all these much more testing available to us and different testing modalities. That's the end of my comments.
Okay, very good. Questions?
Governor Kelly, you no doubt have seen that somebody requested Attorney General Smith's opinion on whether or not, you can enforce any of these emergency orders if need be as a crime. He seemed to indicate that power rests only with the legislature, though he has not yet issued a formal opinion. This is just another example of the constant battle out there for people who want to move faster, who think you're being too restrictive. How much of a distraction is this, and what specific reaction do you have to the fact that people are asking about this? In Lynn County, there's a lawsuit. What is this? How is this complicated to response?
Oh, Jim, I think it's partly pent-up frustration. I think everybody is getting some coronavirus fatigue here, whether they are business owners or local citizens or even elected officials. And so I think that's part of what we're seeing. In terms of the specific Attorney General's opinion, I'm not sure that his office and my office have had an opportunity to discuss that particular opinion, but I can tell you that on every executive order that we have released to date, we have spent a lot of time working with the Attorney General's office to try to get it right before we put it out. So we'll talk with him about this one too and see what it is he means. Obviously, I think executive orders without teeth are useless. So I think there has to be some mechanism for enforcement, that has traditionally been at the local level. I expect it should stay at the local level. But in terms of the specifics on that opinion by the Attorney General, we need to have a conversation with him.
Governor, we've heard from some inmates who have been moved to the Lansing facility or their families that guards aren't wearing masks, they aren't able to change their clothes, they aren't able to contact their family, the list goes on. And there's a big concern that they're kind of being sent to this facility to eventually get sick and not be able to even contact their family. Have you heard about this? And if so, what is the Department of Corrections doing to make sure those inmates are safe?
I have not heard specifically about that issue at Lansing or, quite honestly, at any other correctional facility. It is my understanding that from the very beginning, the Department of Corrections put in some protocols to ensure the safety of not only the inmates but the staff also. And I know that of course would include personal protective equipment and the ability to isolate as much as possible. I think they're doing that via cohorts, just because there's prisons are what they are. By their very nature, you have a lot of people living in close contact, but I think they've tried to separate folks out as much to contain exposure to the virus or spreading of the virus. So, I'll look into it, but I haven't heard anything specific about that.
And Governor, if I may,
Okay.
all the offenders have been tested. So at least at that moment in time, we know the positives and negatives, and then, as the governor points out, are cohorted appropriately.
And are those positives being separated from?
Yeah. Yeah.
Dr. Norman, last week KDHE added probable cases to its count for the first time. Those include, for example, cases where antibody tests were involved. This week, the probable category is gone from the data set. Why is that?
I saw it today.
Did you?
Yeah. Uh-huh.
Okay.
I wasn't aware of it.
She said, if I had to guess, it's maybe because the counties can't vet the probable causes to a level that's satisfactory to KDHE. So
No, the question is on probable, and this goes back to the art versus science in terms of interpreting data, and you're exactly right, Jim. The probable means that a person has a positive antibody test and has had symptoms that are suggestive that they had the illness. That's the CDC case definition of meaning probable, and we include probable in our cases, case count.
had or had?
We do now.
No, but I misunderstood. They're symptomatic, so they probably have the virus currently.
Or had.
Or have.
Yeah, and the reason, again, on the probable, on the serology, the antibody test, is that the antibody tests available have not been specific for COVID-19. It's for the common cold coronavirus, for example. Until we get and we're right there right now with this, with the COVID-19 specific antibodies. The companies are scrambling to develop it as quickly as they can. We have one of the companies here in Kansas, actually, that has a COVID-19 specific antibody that they're waiting for an EUA so that we can start using it. That is a case closed. If they've got a COVID-19 specific antibody, they've had COVID-19.
As far as you know, the probables are still being listed in the data set.
Yes, they are. I looked at it today, as a matter of fact, online.
Yeah, I think what you might be referring to, Jim, is they did not make it onto the report that you saw,
Okay,
or that Celia saw. As opposed to last week, where I think there were at least 2 days when we had probables listed.
Depending on the jurisdiction, these rules are kind of all over the map. You're aware that there's this, in Kansas City, restaurants, people who come in and stay for 10 minutes. The restaurants are being asked to keep a log of people who come in, I suppose, to help in contact tracing. I mean, that's not in force here in Kansas. As you move more into this, though, and the data, and it becomes, the art and the science becomes more difficult to factor out. How important is it going to be that you have data and records that indicate where people were and when for the contact tracing? Do you see moving into something like this?
We have not put that out as guidance, but it is terrifically helpful to have that contact information. Because otherwise, occasionally what we have to do is, if there's been a cluster in an establishment and there's been quite a number of people that have come through, then we put that out there by name of the establishment to alert people that during that interval of time that they need to be vigilant, and certainly if they become symptomatic, to seek care early on in the course of the illness. We have not put that out as guidance. I think that it's always how much does one want to interfere with somebody's privacy and freedoms, and we've not been asked to give that guidance. We've been silent on that.
Yeah, Jim, if I could, it was just last week, I think, on public radio that I heard a segment, and whoever it was speaking, I don't know if it was a reporter or just somebody they were interviewing, said that what they were doing is that they were journaling everywhere that they had been, so that if they came in contact or they felt like they'd come in contact, they could then report those figures. And I think that would be a great way to do it, is if everybody just on their own sort of thinks back every day, who did I see today? And just jot it down, so just in case you get one of the calls from Dr. Norman's contact tracer, that you'd be able to go right back and say, I was at restaurant XYZ between 1 and 1:15 today.
How far along are you where you'd like to be in contact tracing, and what else do we need to get to where you are, to where you'd like to be?
We just need more people. We have our own internal staff that we've added 25. We have, as I mentioned, 217, and we want to get to 400. We don't need to have them today, but we certainly, by the time that the summer and fall rolls around, we would like to have a force. That's what we are estimating that we'll need as a force of 400. It's going to be a little hard to glue together, quite honestly, a volunteer force of 400, because as the governor points out, I'm hoping that they aren't going to be affected by fatigue and lose enthusiasm for this. If that's the case, then we'll have to increase to whatever we need to increase to. And yet it's hard to fund out of current operations the workforce to do that. And also, we hope it will be a time-limited gig for people to do anyway. And the spirit of volunteerism has been quite good.
Can't you use federal funds for that, but college students who aren't in school?
We do have all manner of people of different kinds. We have, for example, a whole cadre of medical students that are doing this, and we are paying them kind of as almost like an internship, like if they were in a job internship. And to be honest with you, Jim, I don't know where those dollars come from, if they're state or federal dollars.
Governor,
Sorry.
on Friday, you said the Medical Society and the trial lawyers were negotiating over liability protections. Do you have an update, and have you spoken with the Kansas Chamber regarding liability protections for businesses?
No, I think that came up on Friday, and I haven't talked with either groups or any of the three groups today.
Secretary, is there a benchmark for where you would like to see the testing rate in the short and long term as the state prepares to go through the reopening plan and colleges figure out, whether or not they can reopen for fall classes and that kind of thing?
That's a terrific question. Testing rate. If we get to 2%, and we're almost there now, we're at 1.81% of our population have been tested, then that is an adequate number for epidemiologic modeling and predicting. What this is, I think, the end game, quote unquote, is going to come down to is what we're seeing shape it now, which is it's about conjugal. No, that's not the right word, is it?
Congregate.
Group. Living situations. Congregate. There we go. As in a congregation.
Yes.
Congregate living situations of prisons and work situations, as in packing plants and nursing homes for living. And I think there's going to be wide open spaces that have very little disease ultimately. So 2% to get to predictions, and then secondly, hotspotting it with an adequate workforce of contact or investigators and contact tracers.
Governor, on Friday, I asked you, or I let you know that people are having trouble getting through on the Department of Labor line. There's no option to hold. They just have to hang up and keep calling back. Were you able to talk with them and kind of figure that out?
I have not had a chance to talk with the Secretary of Labor or anybody over at Labor, but thanks for reminding me. I will do that.
When it comes to these stricter rules, like the rules of the restaurant guidance in Kansas City to help with contact tracing, that's an example. People are it's a fine line balance. People are after you all the time for not going far enough and fast enough and for being overly restrictive. And yet, from Dr. Norman's answer, it sounds like you all have talked about perhaps instituting rules or guidances like this, but have decided not to. Talk a little bit about the balance you're trying to strike here.
Well, the Secretary and I have not had
Okay.
this conversation. There may have been some conversation within the agency itself, but he and I have not had that conversation. And I think maybe we need to have the conversation. My gut is that that's an awful lot to ask of people. People were having enough trouble with the idea that some app, on your phone was following you around and being able to report it, even if it was sort of anonymously where you'd been, much less us asking them to record that. I think that's going a little bit too far, and so I don't see us doing that. But if there comes a time when we absolutely have to for the health and safety of Kansans, we would consider it, but it would not be the first thing on my mind, nor my first choice.
And if I may add, this contact tracing and disease investigation is not new to us. We're doing this right now with other kinds of, whether it's tuberculosis or syphilis or whether it's a food outbreak from a salad bar or whatever it happens to be. This is not new, and yet what you're asking, Jim, I think is a smart question, and that is, do we need to take it to the next echelon? And the governor said, as she points out, we haven't talked about this specifically, and I hope it doesn't come to that.
One more question?
Governor, when was the last time you were in contact with the White House, and do you have a comment on some of President Trump's staff starting to test positive for the virus?
We actually had a call this morning, 10 o'clock Central Time. I was on the phone with the Vice President, who was at the White House, and then a lot of other governors, Secretary of HHS, the Director of CMS. So all of those folks were on the phone. So we're in pretty regular contact with them. And then I'd also say that they've got an intergovernmental affairs department within the White House that works with the states. And so our staff is working closely with them on a whole host of things, a lot on the PPE and testing and all those kinds of things. And, you know, I think that the fact that folks within the White House have now tested positive just suggests, you know, that, as we've been saying all along, this virus knows no boundaries. It can go anywhere, get anybody. Doesn't matter about your political party, where you live. So I think that just is a reminder to us.
Thank you.
Thank you. helping 1,000 families of Boston Public School students to